Hi everyone, it's Carlin Crow, and Funnel Week is over finally at the Capitol, and it's been a really, really busy week. Two of the bills that we've been following very closely that relate to the reorganization of special education and the AEAs in Iowa both passed out of their respective education committees in the House and Senate. And we did a bill of the week on this earlier. So you might remember this. There was two versions of the same bill, both in, or one in each chamber. Well, now each chamber has introduced their new versions of these bills. And this week we're going to focus on the House bill, which is now HSB 713. So that's kind of easy to remember. But it's a House study bill, and since it passed out of its committee this week, it will get a new number. And as soon as we have that, we will update you on that. But to give you an idea of what was discussed and passed by the House this week on this particular bill, we're going to show you some clips from the subcommittee meeting where people talked about their support or opposition or their views on the bill. So as I said, it's the bill number is going to change, and we'll do a new version of this this particular document, so you can get all the new updates on the House web.
Snapshot, I'm the Executive Director at Iowa 60, and we are registered as undecided on the bill. Just echo what others say, we appreciate the continued improvements. Want to just note a couple specific pieces. Iowa AEAs have been an integral part of prevention and early intervention services, an area that is often not strongly looked at and doesn't always have the full capacity around the state. The delivery of these services are really integral to ensuring equitable access to supports across the state, particularly for children that have needs outside of the education system, as well as those who are not yet school aged. These prevention and early intervention services are also not only an important component of the education system, but also that intersection with the behavioral health system. We want to make sure that we, in whatever structure and however this moves forward, that we are maximizing the professional workforce. We know there is such a challenge with workforce around the state, but particularly for the rural communities and for specific regions. And we think that ADA structure, as well as some other opportunities in the bill, can continue to maximize that. And then finally, we just want to note that related to the decision-making structure, again, one of the most important components for us is that we have some ability to ensure that local schools, communities, and regions can adapt to local needs, trends, as well as current events. And we think making sure that structure allows for that will be in the best interest of kids, families, as well, and our communities. So again, thank you for your work.
Everybody's been saying today is I stayed up late and I read the bill in its entirety, and it is a significant improvement from the different versions that I've been seeing. So I really do appreciate that. I can tell you've been listening to the community and working with some of our experts. I do think also the main fundamental core issue with the bill still as it sits is that we're kind of backtracking in time to move away from an integrated model, which I think is what people are really worried about. So this bill still does not allow for provider sharing. So it limits one school district to only use one AEA. And so with the budget plans that still have not been released yet, so it scares us to move a bill forward when we can't really guarantee in this fee-for-service model that our communities will be able to fund that. So throughout a year, we can't anticipate what kind of needs our kids are going to have. We can guess, but if schools are limited without provider sharing, we are not potentially going to be able to adequately and timely receive the services, especially if the AEA cannot guarantee the ability to staff as we currently staff in the shared provider model. So I won't duplicate what other people have said. I agree with what was said. And I also wanted to bring forward that this bill doesn't include crisis intervention services. So there's talk about the fact that that would be included somehow. But I think we actually need to, again, allow provider sharing. We need ADAs to be able to work together to deploy as teams for these unanticipated events, and we need funding written in for that. I second the fact that we are very concerned about so much power to the director of the Department of Education when she is not an educator, and we've had turnover in that role annually for I think about the last 5 years. So again, the school should be able to determine what services they need and request those services without having to fear that there's going to be a rejection of that budget as well as positions being lost. We've already lost some of our ADA providers because of concerns for being able to have a job year after year. That's not how we support our workers. So thank you again. I really do appreciate these amendments, and I hope that you continue to listen to the communities as we go.
Representatives, I'm Melissa Peterson with the Iowa State Education Association, and we are registered in opposition to this bill, but I would like to take a moment and thank you for the work that you've done. This is our favorite so far of the proposals that we've seen this year, but we think there's still an opportunity for improvement. I don't think anybody in this room would say that the existing ADA service or system is perfect. We know that there are other opportunities for improvement. But what we really like about this bill is Division 2, Section 7, the creation of the task force. If the subcommittee and the education chair is open, I would love to work on task force language with you because I think that it would behoove all of us to ensure we've got the right folks from a stakeholder perspective involved in that conversation. If they are folks that need to be appointed by the legislature, I think that's fine. But we just want to make sure we have parents, we have teachers, we have specialists who are involved in education services and special education services involved in that conversation. So we would really like to see that piece move forward. Again, we really do want to echo our appreciation for your continued commitment to work on this issue and get it in a good spot as possible. And I would like you to please take into consideration, we do think the Iowa State Education Association, perhaps the best thing we could do is just do Division 2, Section 7, create a quality task force that allows us to dig into this issue deeply to address all of the concerns you've heard over the course of the last 6 weeks, and then supply a report to the legislature and the Department of Education on or before December 31st, giving us an opportunity to slow this down even further and dig in with fidelity. But we do appreciate the steps we're taking. Thank you.